just noticed that I didn't feel well. It was just uncomfortable, and I was just squirming driving. I was driving over there, and Jason just kept asking me, he's like, do you want me to call the emergency squad or take you to the hospital? And, you know, being a stubborn man, I was like, no, I'll be fine. I'll shake it off. And then going down the little hill into our area, that's the last thing I remember. I passed out, and next thing I knew, I woke up at the hospital.
I honestly don't remember that day at all, and I don't even remember the day after, but I just remember I woke up in the hospital. I didn't know what was going on, and I don't know, I was just confused pretty much.
Steve Meadows and Kanan Dickman are the lucky ones. Every year, about 350,000 Americans suffer a sudden cardiac arrest. 90% of them die. Think about that. 90%. Here's why. In most cases, it takes 2 minutes for bystanders to even realize a person is in medical distress. That delays a call to 911. The average response time for an ambulance is 8 minutes, and if you live in a rural area, it could take up to a half hour. Every minute that passes without hands-only CPR decreases the chances of survival by 10%. But every single person has the ability to save a life. You can save a life. Ohioans are doing it every day. You heard from Steve Meadows, who went into cardiac arrest at work. His friend and coworker, Jason Johnson, was by his side in the passenger seat of the truck Steve was driving when he lost consciousness.
Well, panic number one, when I realized he was no longer awake. I grabbed the steering wheel and guided the truck back down into the loading dock, where I was lucky enough to be able to get my hand on the brake pedal and stop the truck. Once I got the truck stopped, I immediately jumped out of the passenger seat, ran around the front of the truck. I yelled for help, and grabbed my cell phone and called 911. So as I was talking to 911, he'd completely went out. He stopped breathing, and started turning purple in the face. So I realized he wasn't breathing at that point. And I pulled him out of the truck and immediately started the CPR.
Kanan Dickman was running laps on his first day of spring soccer practice when his coach, John Sprunger, saw Kanan collapse.
As he got closer to me, I saw the legs start to wobble a little bit, and then, and I was watching him, and then he just collapsed, and that was, I would say when he first collapsed, it was all right. He fainted. He's dizzy. No big deal. I've seen this before in all my years of coaching, but then it kind of got serious pretty quick. He was maybe 10 yards from me, so I was able to be at his side in just a couple seconds. And his breathing was labored. I kind of described his breathing as he was gulping for air. It wasn't a typical one, so we just kind of stretched him out, tilted his chin back. We're talking to him, come on, Kanan, we're here, come on, come back to us, kind of. And the breathing got less and less. In about a 30-second period, things went from bad to really horrific, like scary. And I had lost the pulse, and I went right into CPR on Kanan.
Jason and John performed hands-only CPR while other bystanders ran to get an AED, or automated external defibrillator. Their quick action saved Steve and Kanan. Both are grateful to the bystanders who were prepared to help.
It's amazing. Everybody knew what they were doing, and they didn't hesitate. There was no hesitation. I don't know that to be a fact because I wasn't wasn't awake. But talking to Jason and my boss, it's and the doctors, everybody was at the right place at the right time and knew what they were doing. So if it wasn't for that, again, we wouldn't be having this conversation.
Yeah, it is overwhelming, and sometimes I just don't know how to put it into words. I'm really thankful though, and I'm glad I'm here.
In a medical emergency, every minute counts. That's the name of a new statewide initiative encouraging Ohioans to learn basic life-saving skills. We're starting with hands-only CPR. Believe it or not, it's so easy to do, you can watch a YouTube video. Or if you call 911, the dispatcher can walk you through it. This is an issue that's incredibly important to the governor. The governor's concerned about citizens not getting medical attention in a timely manner, putting their life at risk. We want to encourage everybody out there to learn these basic skills, and when the time comes and somebody needs your help, step up and save a life. Today, we're going to talk about bystander care, and joining me today is the Executive Director of the Ohio Emergency Medical Services, Rob Wagner. Director Wagner, thank you for joining us.
Thanks, Director Wilson.
And Rob, if you could just take a second, tell the folks about you, tell the folks about the Division of EMS, which is the Division of the Department of Public Safety, and what you do every day to help keep Ohioans safe.
Sure, thank you. I've been a paramedic for 43 years now, and the Division of EMS that I oversee issues certifications to practice for EMS and fire service professionals. We oversee the educational institutions and the instructors who teach EMS and fire. We license private medical ambulance companies, mobile intensive care units, air medical units. We manage over 100,000 certificates to practice. About 50,000 Ohioans hold those certificates to practice in EMS and fire. We also have a EMS training and equipment grants program, and we oversee about $3 million to help support EMS agencies across the state with equipment and training.
And it's your division that has been tasked with initiating this program, Every Minute Counts, getting it out to the different communities across the state, and making sure that people in our neighborhoods know what they need to do to keep their friends, their families, and their neighbors safe, correct?
That is correct.
And you've got a good plan for that, and we're going to get that out the door this year in 2024, correct?
Yes, sir. We appreciate the support. It's vital, and we can increase the outcome from cardiac arrest and survival to 3 times the current rate. It's a fantastic program, and we just want to encourage everybody to participate and help us.
Well, thank you, Rob. We have another guest with us today, and this is a guest that I'm incredibly excited to have, and actually to have the opportunity to meet in person. I've had the opportunity to do some Teams or some Zoom meetings with this person, and we are incredibly fortunate to have him with us today because he's an expert. He's a man who has dedicated his life, his passion, his career, his education to saving lives, and that's what he does. Dr. Benoit is an associate professor with the Department of Emergency Medicine at the University of Cincinnati. He's passionate, again, about keeping people safe. And Dr. Benoit, it's great to meet you in person.
It's great to be here. Thanks, Director Wilson.
So listen, tell us a little bit about yourself. Take us through your education, where you're currently employed, what you currently do, and how you got to that position.
Yeah, absolutely. I started as a volunteer emergency medical technician outside Washington, D.C. I started every Tuesday night sleeping at the fire station, taking calls, and just really fell in love with emergency medicine. You know, a lot of people who go into volunteer firefighting want to, cut people out of cars and, put out fires. And I loved crawling in the back of that car and taking care of that patient while the car got cut off around me, And I did that for a couple of years and said, well, this is never going to be enough unless I know everything. So I then moved to the great state of Ohio, went to Case Western Reserve University for medical school, and then down to Cincinnati for my residency in emergency medicine, followed by a fellowship in EMS medicine. So I actually specialize in taking care of patients outside of the hospital. And as you mentioned, I do research and clinical care and all sorts of public outreach efforts with regards to helping people survive from sudden cardiac arrest.
Well, hey, listen, that's great. Now, I know obviously not all of our listeners understand how the process works through medical school, through residency to become a doctor. And I'm going to have you walk through that just a little bit. But when you set foot in medical school day one, was there ever any doubt that you wanted to be anything other than an emergency room doctor?
Not really. I would say for the first couple of years of medical school, everybody knew I was the guy who wanted to go into emergency medicine. I will confess that during my 4th year, I had a brief interlude where I considered doing cardiology, but fell back in love with emergency medicine. And maybe that's why I do sudden cardiac arrest, because it sort of has a little bit of cardiology in there as well.
Excellent. So walk us through medical school. You learn just the basics. Tell us, kind of about that, and then how you end up in residency, how you choose a residency, and how that process works.
Yeah, medical school is, usually people do it after their undergrad degree. So again, I did undergrad at University of Maryland, then moved to Ohio. Medical school is 4 years long. Usually the first 2 years are very focused on kind of the textbook, the basic science, and then the second 2 years are where you're in the hospital, you're in the outpatient clinics, you're taking care of patients, but everybody kind of does the same thing. Everybody graduates medical school with essentially the same training. That's when you're technically a doctor. You have your MD or your DO, but it's not really until residency that you actually learn how to save a life. And you choose a residency in whatever field you want to go into. And so, of course, I chose emergency medicine. Residency training lasts anywhere from 3 years to 7 years, depending on what specialty you do. And it's funny, to get into residency, there's this big process called the match, where you apply to all these different programs, and then you put a big rank list, and the programs rank. And I was fortunate to get my top choice, which was at University of Cincinnati. Many people don't realize that University of Cincinnati was actually the first emergency medicine training program in the country.
Oh, I did not know that.
Right here in Ohio. And then my couples matched with my wife, who's also a physician. She works at Cincinnati Children's, which many people know, of course, is a great pediatric institution. So we were very fortunate to stay here in Ohio, and now Cincinnati is home.
So you get down there for residency. Now, as a young doc going into an emergency room or emergency department residency, do they throw you right into the fire? Are you working day one in the ER? Walk us a little bit through some of the things you saw and how that training works.
Yeah, I mean, it definitely is a little bit of a getting thrown into the deep end, but you have all these other doctors that are looking out for you. When we work in the emergency department during our first year, what people call the intern year of residency training, we have one of our fourth-year residents who's overseeing everything you do. In addition to the supervising doctor, the attending physician or the boss doctor is looking over everything you do. So it's definitely, I think it's more akin to an apprenticeship. You're doing it, but the person with 20 years of experience is right by you, right looking over your shoulder.
And you're seeing everything that comes through those ER doors, right? Everything. From the common cold up to gunshot wounds, correct?
Absolutely. It's one of the things I love about emergency medicine is we get to see everything. Anything can walk through my doors and I get to deal with it. So I love that breadth of emergency medicine, and I love how connected it is to the community. Whatever's going on in the community, be it good or bad, it inevitably spills into the emergency department. And I love that. I love seeing what's really going on.
And at some point through your training and your experience, you seem to have gravitated more towards, I won't say more towards, but you've developed an interest in cardiac care, heart attack prevention, heart attack response. Walk us through how did you drift that way, and what have you done in that space?
Yeah, a lot of my work has been on sudden cardiac arrest, and happy to explain the difference between sudden cardiac arrest and a heart attack.
Well, yeah, please do.
Yeah,
Absolutely.
a lot of people get that confused. And so they're similar, and they can lead to one another, but they are different. When somebody says a heart attack, we're really talking about that there's not good blood flow to the heart muscle itself. And so the heart muscle starts to die. And that's the kind of thing where somebody might say, oh, I have this chest pain, this pressure sensation. That's an emergency, and you should absolutely go to the emergency department right away. Sudden cardiac arrest, though, is when the heart literally stops beating. The lungs stop breathing. The person will pretty much inevitably pass out. This is what happened to Damar Hamlin, of course. Many people saw that on TV and saw how sudden that was. I mean, it was just in a blink of an eye, and he was on the ground. A heart attack can cause a sudden cardiac arrest, but there's lots of different causes for sudden cardiac arrest. And I think, to go back to your original question of, why did I get into it? I think what I love about sudden cardiac arrest, even though it's a horrible thing to happen to someone, is it is the most emergency medicine emergency in the field of medicine. Nothing is more time dependent than sudden cardiac arrest. And that's why, this every minute counts. It's perfect. It's exactly what we know from the science, from, the medicine, from my own experience. Every minute really does count. That's why I love it.
So let's talk about that. Let's put the why to it. It obviously it's time dependent, but why. What's going on in the body? Why is it so critical to get help to somebody who is in sudden cardiac arrest? And then what's going on with their body, and what kind of help do we need to get them?
Yeah, it's a great question. I mean, it probably doesn't, it's pretty obvious that if you're not breathing, bad things are going to happen, right? And if your heart is not beating, bad things are going to happen. So when that happens to somebody, and we can use Damar Hamlin. I mean, when he collapsed, right, there was no blood flow anymore in his body. In fact, that's why he passed out, because the blood flow drains from the brain, so you pass out. And if nobody does anything other than, just kind of, oh my God, what's going on? Something like that. Well, that person is sitting there with no heartbeat, no breathing, no blood is circulating around the body. And so I think it's pretty obvious then that that person's gonna die very quickly if nothing is done. What's fascinating, though, is that even though that person may kind of look dead, they're not. We can actually bring them back. Death is a lot more gray than we might think it is. And if people act quickly and start doing something, as of course we're going to talk about, hands-only CPR, getting an AED, that person absolutely can come back. But if we do nothing, the brain's going to die, the heart's going to die, it's game over.
Well, I think part of the problem is for anybody who's been in a situation where they've seen somebody collapse, the first response a lot of times is one of being powerless. Yeah. I don't know what's going on. I don't know what to do. Somebody other than me needs to help. Now, the way we do that is by calling 911. That's what we've been trained to do. But there are things that people actually can do to be empowered to actually save a life in this situation. Is that correct?
Yeah, absolutely. And, first of all, I think it's worth saying that reaction you're describing is completely reasonable, completely normal. I think in emergency medicine, we train ourselves not to have that physiological kind of panic feeling when something like this happens. But, for everybody else who doesn't do this day in and day out, of course you're going to feel panicked. So I think that's important to just appreciate, that it's okay, but you're absolutely right that there is something you can do. Because if you start doing hands-only CPR, you start circulating that blood again. You're circulating that blood. Now the heart is getting blood again. The brain is getting blood again. You literally stop the process of death. You stop all that, and you give the person time. Then, if you get an AED there, and depending on what the heart rhythm is, that AED may be able to shock them out of that bad rhythm they're in. That's what happened to Damar Hamlin. And now they're literally going to be awake. So CPR kind of stops time. AED can actually reverse the problem. But I think, in terms of the fear and everything like that, calling 911 is still a great step. And in fact, it's still what we tell people to do. But that 911 dispatcher is hopefully going to tell you to start doing hands-only CPR. And so that's really what we want to make sure people are aware of. So even if you're panicking, call 911. The dispatcher will start telling you what to do, but then you got to do it.
Right. So we've used the term hands-only CPR. And when I was younger, when I was a kid, I went through CPR certification. And if I remember correctly, it seemed like it was an all-day event. It seemed like it was about 8 hours. And they brought out the Recessa Annie dolls, and we learned how to swipe the open the airway and breathe. And there were certain steps that you had to take. And it was very, I won't say complex, but it was a full day worth of training. In the end, you got a little CPR card. There's a lot of people out there who just aren't going to do that. We don't have time. I don't have time to go to a class. I don't even know where to find a class. So a lot of people aren't going through that certification process. And as a result, when something does happen in front of them, they don't feel qualified to do something. So when we talk about hands-only CPR, what exactly are we talking about? And how easy is it to learn? How easy is it to do? And functionally, what is it doing for the person who needs help?
Yeah, hands-only CPR is incredibly easy to learn. It will take me 2 minutes to teach you and explain how to do it. The American Heart Association, for example, has a great 90-second video that shows you how to do this. So the days of the 8-hour-long course are long gone. And there's a couple of reasons why that is. First of all, it was recognized that this is a huge barrier. Like, we're all busy. I get it. I don't have 8 hours to give for some random class, And so there was definitely a big push to make it simpler. And we also realized that all of the stuff that probably freaked people out, like mouth-to-mouth resuscitation, who wants to do that, it's not necessary. When that person first goes down, there's actually plenty of oxygen still in their body. We just need to circulate it. So hands-only CPR is what it sounds like. It's just your hands. That's all you're doing. You're interlocking your hands. You're putting them over the patient's chest, right on that breastbone, that big bony part right in the center of your chest. And you're just going to start pushing hard and fast down onto the chest. So the person's usually obviously on their back and just pushing onto that chest, pushing onto that chest. And there was science behind this, because what we actually found is that will move blood. If you really want to get into the history of CPR, which is fascinating, it was only 60, 70 years ago that we thought the only way to move blood would be to open up somebody's chest, crack in the ribs, and the doctor sticks his or her hands, on the heart and does the, but it was found actually around 1960 that actually you don't have to do that. If you just push on the chest, it builds up pressure in their chest, the lungs, the heart, etc., and then that will actually move blood. So you are providing unbelievable medical care just doing that. All you have to do is push on the chest. And we usually say, it needs to be 100 times a minute, or people will say it should be at the, you sing the Stayin' Alive song, right? Something like that. But that's what really moves blood around. I think the other part that you mentioned there that's just so critical is that people don't feel like they're allowed to. I don't have the certification for this. I didn't take the class. First of all, none of that is important. You are absolutely should, every single person who's listening to this right now is qualified to do hands-only CPR. And in fact, it's what the dispatcher is going to tell you to do. So, if you don't believe me, the 911, the person who picks up the phone is going to say the exact same thing. You absolutely are qualified. And even if you don't do it perfectly, it doesn't matter. We'll often say that any CPR is better than no CPR. No CPR, doing nothing but just calling 911 and standing there and looking at the person, that's the worst choice. If you do anything, you improve that person's chance of survival tremendously.
And my question was going to be, you kind of answered it there, is, well, what if I break their ribs? What if I do something that hurts them? I think that's a barrier to some people taking it.
It is, and it's been studied. We've looked at it, and it's surprisingly not that big of a deal, because so many people worry, like, well, what if I don't need to do CPR? What if this person isn't actually in cardiac arrest? Well, that question has been looked at numerous times, and probably about half the time that happens and you start doing, hands-only CPR, the patient may actually wake up and say, hey, could you stop doing that, please? And so it's fine. No harm, nothing wrong. Even if something else is going on, say it's like a seizure or something like that, again, we would still tell you to do hands-only CPR. And a lot of times that person comes into the emergency department, we figure, oh, actually, they did not have a sudden cardiac arrest. We'll discharge them. They'll go home the same day. It's really not a big deal, and you're not going to injure somebody if you're wrong. And in fact, we know the dispatcher is going to tell you to do bystander CPR, knowing that maybe half the time the person doesn't actually need it. We're still going to tell you to do it. So it's the right thing. It's always the right answer. You can't hurt the person.
Dr. Benoit, I know one of the barriers, one of the issues that prevent people from getting involved in these situations are ultimately rendering life-saving care is a worry about getting sued. And I know people are hesitant to provide care because they think that if they don't do it right or something goes wrong, they may be sued. And we have here in Ohio a Good Samaritan law that protects people in those situations, that encourages people to render life-saving care when necessary. And we have our chief legal counsel here at the Department of Public Safety, Jocelyn Lowe. She's going to talk about that.
Ohio's Good Samaritan law encourages bystanders to help victims of accidents and people suffering from sudden health problems. The Ohio Supreme Court further clarified the law, ruling that it applies to anyone who attempts to provide aid in any way at the scene of an emergency. That means even if you don't have any medical training and you try to help someone in cardiac arrest, you are protected under Ohio law. So take a class, take action, and save a life, because every minute counts.
Now, let's say, Rob and I are out, we're out at a restaurant, and Rob collapses, and he's not breathing, and I can't find a pulse, or I don't know exactly what I'm looking for, but I clearly tell he's not responding, he's not breathing. Nobody else is kind of stepping up and helping. Somebody calls 911. I start doing the hands-only CPR. You talked about getting an AED. So let's talk about that. If there is an AED or I ask for an AED, what is an AED, and then how do they work? How do they function to help in these situations?
Yeah, great question. So an AED stands for an automated external defibrillator. And it is, you've probably seen them on the walls, especially in airports and public locations and stuff like that. And sometimes when people go into cardiac arrest, and this was, likely the case, for example, with Damar Hamlin, it's because their heart jumps into a funny electrical storm, I like to call it. And the way to get them out of that electrical storm is we got to hit the reset button. Just like hitting the reset button on your computer or your PlayStation or whatever, we hit the reset button. That's what the AED does. The AED delivers a small shock of electricity, and it just tells the heart, hey, reset, and it will. And so some people might say, so basically it gets you out of that funny rhythm. It can actually treat the underlying problem. Hands-only CPR buys you time. AED actually treats the problem. Now, some people might be a little afraid of that and say, oh my God, electricity, what, am I going to get hurt? Am I hurting the person? No, it's not that much electricity. This isn't, licking the extension cord for the dryer or something like that. It's very safe. And in fact, the original trial, there was a big study that was done years ago. Patients in Ohio participated looking at AED use, and it was called the Public Access Defibrillation Trial. Public was in the title. It is meant for the public. The AED is designed to be used by the public. And so they're very easy. You pull it out, you open it up, and most of them, as soon as you open up, the AED literally talks you through what to do. So if you take a class with me, I'll spend the first 5 minutes, going over how to do hands-only CPR, and I'll give you a little rundown on an AED. But again, it will literally talk to you. And it basically just 2 little stickers, you put them on, and the AED does all the work. And you basically just need to push the button that's going to be flashing saying, push me, and that'll treat the patient.
We just went through AED training last week here at Public Safety, and literally, just like you said, you open the AED and it starts telling you. There's pictures and diagrams, and I was like, okay, because I imagine in these emergency situations, your adrenaline's up, you're nervous, and it was so user friendly that it felt like it was designed to kind of work you through those nerves and those barriers to taking action.
And the dispatcher, again, you call 911, they're going to help you with it too. They're going to tell you the same thing. And so, you'd call 911. I mean, pretty much everybody has a cell phone nowadays. It's not a big deal. It's not like somebody has to go run to a payphone. You dial 911, you put it on speakerphone, and the dispatcher will start walking you through these things. If it's just you, you'd start doing hands-only CPR. If there's a second person who can run and grab an AED, great. If there's a whole bunch of people, then you can all start doing, hands-only CPR. But again, anything you do is better than nothing.
And I was gonna ask this kind of a nice segue. You heard me talking when I was giving the initial statements about the delay in response times that we have across the state, especially in some of our rural areas. Literally, you have a volunteer department. They're doing the best they can. They are really dedicated public servants, but because of geography, because of staffing issues, they may not get to an emergency scene for up to maybe 30 minutes. And if you could, not just, we've talked about cardiac emergencies, but in any kind of traumatic, life-threatening emergency situation, what is the value of somebody doing something in that intermediate time before the emergency professionals get there?
It's huge. And even I live in Cincinnati, the response times are relatively quick, but even then it's still minutes. And so calling 911, which we've all been taught, is great, and you should still do that. And they're coming. But as you said, I mean, every minute counts. So when you're talking about somebody who's not breathing, every minute counts. If you're talking about somebody whose heart's not beating, every minute counts. If you're talking about somebody who's bleeding because of, they just fell off their bike or, they got into a car accident or whatever, and they're bleeding, every minute counts. So those 5 minutes, that's an eternity. And so if the people who are there, if the Ohioans that are there calling 911, we need them to do something. And again, the dispatcher will help you, but these are they're not that hard. Holding a little bit of pressure on that part that's bleeding, or doing CPR, or getting that AED for those really, really time-critical emergencies. That's when every minute is just of utmost importance.
In an effort to practice what we preach, or to do as well as tell other people to do, last week, again, we brought the leadership in from the Department of Public Safety, and we went through some of these first aid, emergency medical, life-saving type skills. So we covered hands-only CPR. We covered use of AED. We covered stop the bleed, and that was both use of a tourniquet and wound packing. We covered use of an EpiPen, and we covered use of Narcan. So is there any other skills as an emergency room doc that you would think that it would be important for a person to know or understand to deal with something that they may face out on the streets?
Yeah, that was a great list. I think everything you just said, I 100% agree with. I think everybody should know a little bit about how to do that. I think the only other thing I would add is, bleeding is another thing that scares people, right? A lot of people don't like the sight of blood. Totally get it. Very natural, right? However, just calling 911 and then watching the blood accumulate on the floor, it's not the best, right? And again, it doesn't have to be that complicated. If you have a tourniquet, if you have something to pack the wound, okay. But literally just holding your hand directly on where it's bleeding, 9 times out of 10, that'll just stop it. And, so many people get, they get the towel and they get the whatever and the gauze, and they put this big thing over it. But that doesn't actually stop the bleeding. Sometimes it just kind of helps the blood get sucked out of the wound,
Right.
And so what I often tell people is truly just wherever you see bleeding come, just put your hand on it and push hard, usually against a bone or something like that. That'll stop the bleeding.
Okay, that's good.
If you have a tourniquet or whatever, great, but you don't need any. Just like you only need 2 hands to do CPR, 9 out of 10 times you only need 1 hand to stop bleeding.
Gotcha. And I was in the military back in the day, and we learned how to put on field dressings and pressure dressings. And so last week was the first time that I ever had experience practicing packing a wound. So for the listeners who are listening to this, packing a wound is literally stuffing gauze or cloth into a hole in a person's body, and you basically just keep stuffing as much as you can get in there until the bleeding stops. And we were doing it with little rubber dummies that had holes in them. And I got to tell you, look, I think when the time came, if I needed to do it to save a life, I could do it. But just doing it there, I was feeling a little bit woozy. I'm like, whew, this feels unnatural, sticking your finger in a hole in somebody's body. So I certainly could see where there'd be a barrier or hesitation to do that. But again, if that's what it requires to save somebody's life, then you need to do it. But hearing you say, look, just put pressure on it is a nice alternative.
I mean, again, I think anything you do is better than nothing. So if you have supplies and you can put on a tourniquet or pack it, sure. But again, just putting your hand on it, that's all you have to do. I mean, I see a lot of bleeding in the emergency department. I work at a level 1 trauma center. It is very uncommon that just holding pressure over the wound, fails.
Okay, that's good to know.
9 out of 10 times, that's all you need to know. You just got to help the body. The body doesn't want to bleed. You just need to help it along a little bit.
That's great to know. So let's say that I'm Andy Wilson, not the Director of Public Safety. I'm just Andy Wilson, accountant who works out in one of our towns across the state of Ohio. And I've listened to this, and I want to learn some of these skills that I may need to help keep someone alive. I'm just interested in learning a baseline to help protect my family or my friends or anybody that I may come across. Where do I even begin to start to learn this stuff?
Well, I think that is part of what Every Minute Counts is going to start rolling out. I think here in the state, we're going to start trying to provide more and more resources and get really explicit about how to learn it. But if you're excited right now and you want to start, learning these things, I highly recommend just type into Google or what have you, American Heart Association and CPR. There's some great 90-second videos that the American Heart Association puts together. There are other organizations. There's a whole group called Stop the Bleed that provides a lot of information on, again, kind of some of the stuff we talked about, pressure on a bleeding wound, tourniquets, and stuff like that. Those are great. In my neck of the woods in Cincinnati, we have a program called Take 10 Cincinnati, where it just takes 10 minutes and we teach you all of the same stuff, and we usually pair it with Stop the Bleed. But there are, or if nothing else, you can give me a call and I'll drive over there and I will train you. I'm very passionate about this, as you can tell. But yeah, I think, and hopefully at the end of this, we can, have some links or whatever to where you can get this kind of training. But it doesn't take all day. It really doesn't.
We will certainly add links for folks who listen to this as resources to go and learn some of this stuff. I want to kind of flip from a general audience maybe to our first responder community that may be listening to this. A couple things. If you are interested in doing some of this Every Minute Counts work in your community, Rob, how can they help us? What kind of stuff can they do? How can they engage with their Lions clubs or their schools, or how can we get this information out so people are actually putting this training on in the community?
I think we can reach out through the fire services and through the EMS agencies in the state, as well as the educational institutions that train EMS and fire providers. That's over 600 institutions with continuing education, initial education. We have over 1,100 EMS agencies in the state. They're in every community. They can reach out to their civic groups. A lot of work is done through the elderly groups, lots of support through the various Rotarians, through the Eagles, a whole lot of civic groups will support this training. Any collection, you can actually do some of this training 5 minutes at halftime at the local high school football game. Work with the athletic director and see if you can put a video up, like Dr. Benoit said, 90-second video. You can have everybody in that stadium at least be exposed to hands-only CPR, so that when that time comes, at some point, once they've seen it, that voice of calmness when they contact dispatch can talk them through and help remind them and be the calming direction for them to perform the compression and perform it at a rate of 100 to 120 compressions per minute. So I would encourage the EMS and fire service communities to work in their local areas and try to find avenues to get this message out through schools, through, elementary students can certainly learn CPR and do CPR effectively and learn some of these other ways to control bleeding and help patients and people that need help. The tragedy in this state is that every year when EMS responds to calls for help, they get to a number of scenes where if somebody would have done something, as soon as they recognize the need for help, they could have made a difference in the life of a person. They could have helped a mother see the birth of her first grandchild. They could have helped a father walk his daughter down the aisle for a wedding. And without that intervention between calling for help and waiting for trained professional first responders, be it law enforcement, fire, and or EMS, to show up and take over care. It's really sad to see, and EMS understands that. We do the best that we can in those situations. We treat the patient, but time is critical. Every minute counts. And if we can help the public become comfortable and at least willing to step up and help when they're a part of that emergency scene, it will go a long way and help a number of of patients in Ohio.
Rob, you make such a good point, and I would encourage the listeners to kind of think of it in this terms. Look, if it was your daughter, your son, your mom, your dad, your spouse, your partner, someone you cared deeply about who was having a medical emergency and you weren't there, but other people were, man, you would be hoping and praying that somebody there would do something. And you would be devastated, I think, to find out that your loved one died while surrounded by people who stood around feeling powerless to do something when they could have been saved if some action would have been taken before EMS would get there. I mean, that's the way that I like to think of it. I think that for our first responder communities out there who are going to do some of this training with their jurisdiction or with their community, the actual training of how to do these skills obviously is the major part of it, but you also need to wrap that training in a message of empowerment. And we need you, the people who are getting this training, to take action when the time comes. So I think that's key as well. Dr. Benoit, we do have a number of first responder agencies that listen to these podcasts. I know something else you're passionate about is Ohio Cares. If you can talk about that, Cares Registry, and what you do in that space, we want to make sure that we are encouraging mass participation in that program for our first responder communities.
Yeah, Ohio Cares. CARES stands for the Cardiac Arrest Registry to Enhance Survival. It was started down in Emory University in Atlanta, maybe 15 years ago or something like that. We've been doing it in just a few communities in Ohio for about that amount of time. But now, over the last about 5 years or so, people like me who are very passionate about trying to improve, the care of these patients got together and said, well, we really want this across the entire state of Ohio. And so Ohio Cares is an infrastructure that basically collects a whole lot of information on all of these sudden cardiac arrests. And then what we do is we take that information, we learn from it, and then we can feed it back to those EMS agencies, those fire departments, those first responding agencies, and say, hey, here's what you're doing amazing. Here's maybe where there might be room for improvement, and help learn from what we're really doing. Because the challenges are real. I mean, we know that. Again, if you're talking about a more rural part of Ohio, the response time may be longer because the resources aren't there, or there's just not that many ambulances in that county. And so then that might be the kind of place where bystander CPR is the answer. But maybe there's other places where bystander CPR is great. That's not the problem. And, maybe where, we need to do something on the hospital side or something like that. So CARES provides all of that information. And so for any of the EMS agencies that are listening to this, if you're not already aware of CARES, I encourage you to check it out. It's easy to become part of Ohio Cares. It doesn't cost any money. It actually provides great feedback to the EMS agency on how they're doing, gives you patient outcomes, all sorts of information. You just go to ohcares.net. That's our website. And that's just another part of what I do to try to improve cardiac arrest survival in the state of Ohio.
Listen, it is such a great program. We encourage everybody who's listening to check it out. If you're not participating, please participate, because, again, what it ultimately ends up doing is empowering you with information that will allow you to do your job better to protect the people that you're assigned to protect. So it really is a great program. Well, listen, we're gonna finish up today. I cannot express enough how thrilled that I am to have the two of you. Appreciate everything we're doing in this space. The Every Minute Counts program or initiative certainly will save lives. Dr. Benoit, I cannot thank you enough personally for what you have done. Your expertise, your training, your knowledge not only saves individual lives for the people who come into your ER, but it is corporately spread across the state and saves lives of all Ohioans. So we appreciate what you do. And we just can't say enough about this program.
Well, I appreciate it. And I will turn it right back around and say, as a listener of this program, if you do bystander CPR, you can save a life. I'm just trying to give the message across, but it's really the citizens of Ohio that can save those lives, literally hundreds, thousands of lives. I'm just the messenger, but, the Ohioans are the ones who are really going to save people.
Well, listen, thank you very much. Thank you for what you do every day to keep Ohioans safe and sound.
The Safe and Sound podcast is recorded by the Ohio Department of Public Safety. Links and more information can be found in this episode's show notes. And for more information on all 9 divisions of the Ohio Department of Public Safety, visit publicsafety.ohio.gov.